Okay, good evening, Pahrump. I'm Dr. Michael Reiner, and this is a live show. That call-in number should be at the bottom. It'll flash up pretty soon, 727-8750. And this is the Independent Doctors of Pahrump TV shows, where we talk and discuss of all types of subjects, matter dealing with medicine or sometimes even political subjects. And I had the last time on the last show, Ray had called in and asked about the hantavirus, which is something that is very interesting and sparked my interest in those particular types of viruses, and did a little research. And I've prepared a few slides, and hopefully we can get those incorporated. My producer is working on that as we speak. In the meantime, one of the things I'd like to talk about maybe in the first part of the segment of the show is a few things that have come up in the office. And one of those things that came up into the office today was, which is very important, is how do you evaluate a complaint, an ache, a pain, something that you're just not quite sure of. You've had it, but you don't really know if it amounts to anything, and what do you do in that particular case? And, you know, we've all had a pain in our shoulder, we might get a pain in our chest, we might get a pain in our back, and you know, we don't want to be a burden to the doctor, we don't want to be a burden to go to the office. Somebody really likes to go to the doctor's office and think that they're wasting the doctor's time, or that there's, you know, they don't want to look foolish. And so for me, taking a history of an ache or in pain or any particular symptom, it involves a story. And the story, usually as it develops, will fit a particular pattern. And so let's talk about, maybe you have a sharp pain in your chest. And there, of course, everybody gets a pain in their chest and they're worried that they might be having a heart attack, or they might be having a blood clot to their lung, or they might be having some form of cancer. I mean, we as human beings tend to run with the worst of everything that can possibly be. So a sharp pain that comes for a very small instant and usually goes away is what they call a musculoskeletal pain. It may be a diaphragmatic spasm, it may be a chest wall spasm, and if you have those occasionally, and they come and they go, there's usually nothing to worry about. But what if that pattern would change? And this is the key here. If you have this occasional sharp chest pain, and all of a sudden you get a similar pain, and it lasts a little bit longer. Maybe instead of it being a brief breath-like pain, it may last several breaths. Maybe, and then it goes away, and you think, okay, well, that was kind of interesting, I'll watch it. And then it might come back in about 2 or 3 days, and it might last a little longer. So the pattern tends to be changing. So when a pattern of a pain changes, that's when you as a patient should be somewhat questionable and somewhat alarmed. If it comes every month and just briefly goes away, it's probably no big deal. You probably had it all your life. I wouldn't worry about that. But if it suddenly changes, and then it basically all of a sudden changes in frequency, instead of it coming once a week, it's coming every other day, and it's lasting almost like labor pains. They tend to be coming more frequently, longer, last longer. That would be the time to come check out and ask the doctor to take a look at that. Same thing with headaches. If you have naturally occurring headaches, it's very important to realize that we all have headaches. What are those headaches like? Do they change in pattern? I mean, there are obvious headaches like migraines. And migraines, I've talked about them on the show before. There are visual migraines, and there are visual migraines with headaches, where you actually get a headache. And the visual part of that, the flashing lights that we see with migraines, are a actual vasoconstriction of the blood vessels that go to the optic nerve. And it's actually all of your cerebral blood vessels are basically constricting. And it is after this constriction, when they dilate, that they allow fluid to exude out of the intracellular or intravascular tissues into the surrounding meninges or the surrounding brain tissue, and then that causes the headache. So if you have a migraine and the pattern seems to be the same, then those are probably not that big a deal. But if all of a sudden the pattern changes, meaning the pattern becomes more frequent, the migraines are coming more often, they're lasting longer, the medication that you've been taking for those migraines are not helping that, then that really derives a visit to the doctor's office. Very important for you to be in tune. And really, nobody knows your body better than you do. You've lived with certain things for all your life, and sometimes those things change. I mean, and we tend to forget the accident that we had 5 years ago where we fell. And we all of a sudden want to know why our shoulder is hurting today, and those types of things. So you have to try and remember that history and the history of the illness and how it occurs and where it goes and how it changes is incredibly important to me as a physician to be able to decipher everything that is going on so that I can make an appropriate decision about what test might confirm my diagnosis or my theory of what is going on with you as a patient in that particular time. So, and the same is true with sore throats. I had a patient in today who had a sore throat that had been going on for approximately a month. Well, and I explained to that patient that a sore throat that goes on off and on for a month is likely not an infectious etiology. So we're going to talk a little bit more about that, sore throats and other chronic stuff, and a little bit about MERS and hantavirus when we come back from the break. Stay tuned. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.